We had mentioned some of these new medicines on
Yes.
television that they say they really have possible side effects. That's what the government requires to say.
Right.
So what are some of those, and what do they do, and how effective are they?
Well, very effective. The way psoriasis studies are done, you kind of have to quantitate what an individual person's psoriasis is like before a study so that you can see by how much they improve. So you'll see what's referred to as PASI scores, P-A-S-I, Psoriasis Area and Severity Index. Okay, and this is where you take a person and you see what percentage of their body is covered, and then you look at how severe their psoriasis is, and there are metrics for that, and you come up sort of with a number. Okay, and then the goal of these medications is to reduce that number. Exactly.
Can you get it down to 0 sometimes?
Well, we're getting close. Yes, yeah.
Isn't that great?
So with some of the older medications, which some people might be familiar with, methotrexate and cyclosporin that I mentioned earlier, you certainly got individuals who did very, very well, but overall, you were lucky to get 30 to 50% reduction in the PASI score.
So in resistant patients, the severe or the moderate to severe, it would help, but not as good as you wanted.
Well, that's right. And those medications had risk to the liver and kidneys. They could cause hypertension, a variety of different problems. So not perfect drugs by any stretch, but still ones that are in our armamentarium, and they're inexpensive, which these days can be a big factor. So we certainly can still utilize those. But
so what's new?
But the newer medications, okay, and these are getting to where some of them are not that new. I think you referred to the one that has the ad for psoriatic arthritis with Phil Mickelson, so that's Enbrel, okay, and certainly it is very useful for psoriasis. And it can get the PASI to near 50%. So a 50% reduction in the amount of psoriasis a person has is not an uncommon number with Enbrel. And also has, again, a low risk profile. Humira may even kick that a bit higher, up to about 75%. And then some of the newer drugs, Cosentyx and Talx and Stelara, which are all big names.
Stelara, Cosentyx.
And Talx, those can get up between the 75 and even upwards of 90% reduction.
So the newer medicines now, certainly can't get those over the counter.
Right.
You see your dermatologist
Right.
who's trained and can guide those medications. How successful are they? 75%?
75 to 90%, and many of them reduction in the score, meaning taking somebody with pretty significant psoriasis over large parts of their body and bringing it down to a PASI 90 is fairly clear, and I've seen it many times.
Where do people get information on this? You had mentioned earlier there's one website where there's information that is so good for people.
There's an excellent website that will cover all of these medications, and that's the website of the National Psoriasis Foundation, and it's psoriasis.org.
So psoriasis.org, and it's important to put the org on that. So there's a lot of information there that can help people.
Right through what I've talked about.